Fears that the small businesses may be falling short of the Safety and Health at Work Act. A body washes ashore at Needham's Beach. And in sports, Dwayne Smith's Super Kings keep Mumbai Indians winless in the IPL.
Credible, balanced, committed. This is the CBC Evening News.
A very good evening to you. I am Pearson Bowen. Labour Minister Senator Dr. Esther Bayer-Suckoo is worried that a number of small businesses are at risk of failing to comply with the Safety and Health at Work Act, and many of them include hair and nail salons. She says it stems from the lack of adequate ventilation in some of these establishments, which is putting the health of hairdressers, nail technicians and their customers at risk from the chemicals that they use. The Labour Minister wants these business people to acknowledge their responsibility to protecting their health and the well-being of their clients.
Every time I say proper ventilation, I think of the lady who does nails in a small little room that is 10 by 10 with no windows, and she's breathing in the acrylic powders and the glues and the gels, or the one that does hair in the small salons, and again the glues and the chemicals. And I'm so very concerned that a lot of those establishments are not operating with proper ventilation. But as I said, the Labour Department, we are on a program of monitoring, and inspection is a very important part of the National Framework for Action, and it's all for everybody's benefit, because even the small establishments, not to make life more difficult for these small businesses, but essentially to make their quality of life better in the long run.
The Labour Minister made the comments as Barbados commemorated the International Labour Organization's World Day for Safety and Health at Work with a workshop at the Lord Erskine Sandiford Centre. The focus, safety and health in the use of chemicals at work. The Minister did add, however, that most businesses across the island are complying with the regulations of the Safety and Health at Work Act.
I am pleased with the awareness and the compliance that I have observed, and I haven't really received any complaints about the cost of changes. In fact, some of the workplaces haven't had to make a lot of changes because they had already started before the proclamation of the Act. They'd started to put things in place. So, and many employers and employees are actually buying in very readily to the concept that making these changes is for the benefit of everyone. And I've experienced that as I've gone through several workplaces.
Meanwhile, a senior union official is calling for the introduction of safety data sheets in workplaces. The suggestion comes from the Congress of Trade Unions and Staff Associations of Barbados representative at that workshop, Wayne Warrand. He told participants that the sheets create a simple but effective management system to mitigate against hazards in the workplace, especially as it relates to the handling of chemicals.
Everyone should appreciate having safety data sheets in the workplace. They provide comprehensive information about the chemical products that allow employers and workers to obtain relevant and accurate information. This can be used in taking precautionary measures against hazards and engaging in the risk management. Safety data sheets provide information that include identification of chemicals, properties, composition, hazards, first aid measures, firefighting measures, handling and storage, disposal, and ecological information. Safety data sheets form part of an efficient chemical management system.
Barbados is the pilot country for an international study on hypertension. It's called the Global Hypertension Project and is being conducted by the Centers for Disease Control and Prevention, and with figures indicating that between 35 to 45,000 people in Barbados are hypertensive. Principal investigator Dr. Kenneth Connell says the project is timely.
The project essentially isn't just about changing drugs, but it's about changing systems, how healthcare professionals, and not just doctors, but nurses, pharmacists, all healthcare professionals are managing hypertension, how they're interacting with patients, what do they think are the key objectives, what do the patients think are their key objectives. And it has the potential to change the way we think hypertension should be managed. One, it has the potential to change how our patients, what are their own perceptions of how their healthcare provider is managing their own blood pressure. in the office, and it gives us an opportunity to be seen on a global scale.
Dr. Connell was speaking during the first masterclass on hypertension hosted by the University of the West Indies Faculty of Medicine. Senior Medical Officer Dr. Kenneth George says that according to the Ministry of Health, the condition is also the #1 risk factor for cardiovascular disease, heart attacks and strokes, all of which are increasing in Barbados. He says the Ministry of Health is collecting more information about hypertension.
We're trying to do a SALT study, which the results will be soon available to the public of Barbados. And we're also trying to do routine surveillance to try to see if we can see what the levels of hypertension are in our population. But the exciting part of this project really is that we are looking at novel ways of looking at hypertensives and their treatment, particularly their pharmacological treatment in Barbados. And I think that this is a process where we will try to use the relevant drugs on our formulary, which are very many at the moment, to see the best outcomes for persons.
Police investigations continue tonight to determine the identity of a man whose body washed ashore at Needham's Beach near the Hilton Hotel. Police Public Relations Officer Inspector David Welch says it was discovered by a visitor on an early morning stroll around 6:30. The body was reportedly in a state of decomposition. Inspector Welch spoke to CBC while on the scene.
The security then summoned the police. So at this point in time, we just undertaken the forensics. So investigation is to determine the identity of the body. How that will be done, maybe by either dental records or DNA. So that is how we need to proceed.
Well, on Monday, 43-year-old British national J. Merriman Mokoro disappeared after he went swimming with his family in the waters off Rockley Beach, Christchurch. He has not been seen since. Several members of the spiritual Baptist faith gathered at the Zion Apostolic Church in Richmond Gap to pay their respects to their late leader, Archbishop Granville Williams. The Archbishop died earlier this month at his Ealing Park, Christchurch home. The 90-year-old had been battling health issues for some time. An appreciation service is to be held in the Archbishop's honour this Sunday at the Garfield Sobers Gymnasium. This will be followed by a second service and burial at the Jerusalem Apostolic Spiritual Baptist Church in Ealing Grove on Monday. A family of 5 is in need of somewhere to live urgently. Esther Worrell, the tenant of more than 7 years of First Avenue, Station Hill, St. Michael, is concerned about her children, the eldest, a disabled 23-year-old, and the youngest, a 13-year-old. Kimita Jones has that story.
A welfare recipient, Esther Worrell, is overdue on leaving her landlord's property, and action is being taken. Landlord Jocelyn Morris told CBC via telephone that notice was given to the tenant's male partner on the 29th of March. He has since moved out. Ms. Morris adds that she has placed a for sale sign on the house and she wants it sold as soon as possible. Ms. Worrell, a mother of 4 and grandmother of 1, is now in need of somewhere to go. Since Tuesday this week, the house's paling and wooden structures have been dismantled by a crew hired by her landlord. This has left their bathroom facilities exposed to the public.
At the moment, I ain't seen nobody coming to me for my assessment, so I am pleading for my children to please to help me, because at the moment I cannot bathe in that bathroom, so I'm begging please to come and help me.
Neighbor Claisha Banfield, who is also upset about the situation, says the family needs better and safer living conditions.
I passed by Esther and I actually left her in tears because all she was saying is my children exposed to everything, and how my girl's gonna deal with this. She daughter, the one that disabled, Vanessa, she loved to wash, she loved to do everything. When I went there, the little girl had her clothes over a wrought iron chair.
Ms. Bernard hopes someone will find a place for the Worrell family soon. Kimita Jones, CBC News.
Culture Minister Stephen Lashley says the National Cultural Foundation is talking with one private sector interest regarding the cavalcades, but nothing has been finalized. He was speaking during a crop-over press briefing at the ministry yesterday afternoon, where he announced that the cavalcades have been cancelled, barring private sector support. Touching on the four-day morning jam, he says it continues to grow, with interested bands this year currently numbering 70. More importantly, it will have a separate day on Saturday, the 2nd of August, and will move off from 3 separate points: BTI, Weymouth B, and the BIDC.
The continued growth of four-day morning jam has necessitated the need for the event to be held on a separate day. That issue has been canvassed, discussed. There are varying views, but having looked at all of the information and having looked at the advice given by the Royal Barbados Police Force, I have indicated to the National Cultural Foundation that the event ought to be held on a separate day, which is the Saturday.
At least one popular Kadooment band is cutting back this year because of the economic climate. But management of Lucky Horseshoe's Jump Promotions is promising patrons it won't be reducing the quality of its package for Crop Over 2014. Sean Farrell reports.
Among the changes to the Jump Promotions band this year are a reduction in numbers and a new partnership with Trinidadian designers Nina and Ian McKenzie.
We're seeing how it works and the synergies, but here in Barbados, obviously Jump is going to be doing its own thing, and we'll have the same experience as we normally do, although we're downsizing this year because of the economy. We'll only bring 500 people on the road this year rather than the traditional 1,000. However, next year we're hoping that things will go a little different, and with the partnership we'll be able to actually buy a package that you jump in Trinidad and then in Barbados in the same kind of costume.
This year the band is called Jump Gone Wild, and it has a jungle-based theme.
So we're doing the wild beasts, and we're doing also the wild people of the jungle and of the, the wild forests and all of the different Amazon and stuff like that all over the world. So it is a different sort of theme we're going with this year, but I think it's going to be wild, and that is the whole theme of it.
The management of Jump Promotions says the experience should be enhanced this year. Among the additions is the serving of not only drinks, but food to members all along the route. Sean Farrell, CBC News.
The Barbados Water Authority is not issuing any warning notices just yet to householders to stop watering lawns or using water for non-domestic purposes. That's the word this afternoon from BWA General Manager Dr. John Mwanza. However, he's asking Barbadians to continue to be prudent in the use of this precious resource. Dr. Mwanza's comments are in response to other Caribbean countries issuing such notices to their citizens to conserve water in the face of current drought conditions. Among those countries are St. Vincent, St. Lucia, and Jamaica.
Our water is also stored in the ground and has a lag time, so it does not respond immediately to the changes in impacts of rainfall, because you'll be using water that fell a few months back. So they would feel the impact before we feel anything.